Also thank Baroness Cumberledge and all those who contributed to this really important report. And also as someone who met with the women in 2017 in the event organised by Neil Finlay to pay tribute to their courage, their determination and their tenacity in making sure that this issue was given the full exposure that it so rightly deserved. The report does cover three important areas in terms of the hormone pregnancy tests and sodium valproate, but the area that I want to look at in particular, as many people have this afternoon, is in the pelvic mesh implants and what that has, what the consequences of that have been for many, many patients in this country. And I stand back and ask, how is it possible that this could have gone on for so long and that the concerns raised and the voices of the women had gone on ignored for such a long time? And I do think that it strikes of a bias in the medical professions, unintentional bias or intentional bias, but there is a fundamental attitude that has to be challenged here. And I really do pay tribute to the women, because if they hadn't been so tenacious and brought their voices forward and ensured that this report came to publication, that we are debating it today, that some of these issues would have gone unaddressed in our health services. In 2018, Serena Williams was very vocal about her experience giving birth to her child and what she saw as the complete lack of medical attention to her concerns during childbirth, and she was very, very seriously ill and suffering from thrombosis, and virtually had to beg for the assistance she needed to save her life and the life of her child. And I think that brought to fore what was mentioned by Alison Johnson earlier on, is the amount of health inequalities and biases in our health service. In 2020, the Royal College of Gynecologists, the Royal College of Obstetricians and Gynecologists held a special International Women's Day event looking specifically at the issue of inequalities for BAME women, and pointing out that in multiple areas of healthcare, it shows that how essential it is for action to be highlighting and addressed to tackle the disparities that are literally costing lives. The main focus of the work of the Royal College of Obstetricians and Gynecologists Women's Network was to ensure that women's voices are heard, their views and their experiences are used to shape education, guidance and policies around their care. In order to reduce the disparities, we must open up the debate and ensure women's voices are at the centre of it. And without the women's voices of the MESH survivors, we wouldn't be here today. I would like to talk about something that's already been raised by Alex Cole-Hamilton and Mr Cameron as well, and that is someone who's forgotten in this, and it's one of my constituents who I won't mention by name, but I have her permission to talk about her case today, and it's one that I have written to the Health Secretary about in the past. In 2008, my constituent suffered complications after a caesarean section, and contracted a nosocomial infection that led to her requiring mesh implants to rebuild her abdominal wall. A very young woman at the time, but since then has exhibited the same pain and the discomfort and all of the complications that we've heard about today from the mesh that she believes has caused her issues with pain and terrible chronic pain at the moment. She repeatedly asks for joint gynecological and plastics consultations, repeatedly asked to be seen by a plastic surgeon, and although that is likely to happen now, she's been asking since 2008 and only now is getting in front of the medical professionals who can explain to her what has happened. She doesn't know how much mesh is in her body. She doesn't know where it is in her body particularly. She just knows that since she got that mesh put in, she's experienced unbelievable chronic pain. She has made many requests for full medical records to be given, and only now has she got those, which hopefully will help her get some of the answers that she's been looking for. And while we will continue to represent her in trying to alleviate this situation, unfortunately, in the current rules, she falls out with the very welcome support that has been put in by the government for those who have suffered transvaginal pelvic measure. Yes?
No, Miss Adamson's just closing, actually.
Sorry. So this is someone, if my hope from what today is I hope that the appointment of a Patient Safety Commissioner will ensure that no one is left behind who has been affected by these issues. And again, I commend all of those women who have fought so strongly to have their concerns recognised, listened to. If anything, this is about never, ever not listening to the patient voice, the voice of the women who have been affected by this. Thank you, Presiding Officer.